It is not an overstatement to say that we are in a crisis with COVID-19 in New Mexico. In this video, we will take a look at why that is so. This rise of cases in New Mexico has a special name. We call it an exponential growth. How do we know this is exponential? We can plot the same data on a different kind of graph. This is called a log linear graph. Instead of going 10, 20, 30 in a linear fashion, it goes 10, 100, 1,000 in an exponential fashion. When we plot data on this kind of a graph, there is a unique characteristic, and that is when there is a straight line. That's how we know that growth is exponential. And this line that we see today is due to exponential growth. What does exponential growth look like? This is affecting all age groups in New Mexico. Here are young adults. Here are somewhat older adults. These are the people that keep the economy going. People over 65 have a much higher risk of death. It could be as high as 1 in 5. COVID-19 rates are growing for them as well. Children, and even young children. In the past, there have been spikes in different regions of the state, but now every region of the state is experiencing exponential growth. This is the test positivity rate. When a test positivity rate is over 5%, contact tracing no longer works effectively because people are spreading it before they can be contacted. It also means we don't know the true prevalence, that is, how many people out in the communities actually have SARS-CoV-2, the virus that causes COVID-19. With a positivity rate of 10%, the true population prevalence could be much higher, and experts disagree on how to estimate that. But it is not impossible that 1 in 5 New Mexicans carry the virus at this point. Since the first case in New Mexico in March, there have been well over 1,000 deaths by now. This is not an official projection. This does not come from any agency. This is my viewpoint only. But I think it is very likely that COVID-19 will be the third leading cause of death in New Mexico by the end of the year, and it could even become the second leading cause of death. By the end of the year, we could easily have 5 times more dead New Mexicans than we would get from flu and pneumonia. But death is not the only bad outcome. In some studies, heart damage, persistent heart damage, is a real problem, and this could happen in perhaps up to 60% of patients with COVID-19. People with COVID-19 can get strokes, and recent studies suggest these strokes can be more severe than the typical stroke. We know there is a propensity to clot the blood with COVID-19, and many people are reporting long-term neurologic problems, such as a form of brain fog, as well as neuromuscular weakness. But here's what you really should worry about the most. This graph shows the total number of new hospitalized patients with COVID-19 per day. We have reached an unprecedented level of hospitalizations. Well, it certainly matters if you have COVID-19, but it matters if you have anything else that requires hospitalizations. It means that a hospital is less capable of treating your heart attack or your stroke, or if you get in a car accident, or if you have diabetic ketoacidosis. Now you may think, well, can't we draw from doctors and nurses and healthcare people in other states? In normal circumstances, when an area has a disaster, other areas do not share the same disaster. They can therefore send resources. But right now, the entire country, and certainly the states surrounding us, are all facing the same crisis. Doctors, nurses, healthcare professionals, they are all being stretched to the limit, and we cannot just create them from scratch. At least in the next couple of months, hospitals are likely to face a true crisis. In the worst-case scenario, that is not out of the question, there could be rationing, where the decision as to who gets limited resources may have to be made. Okay, we've answered what kind of spread. It's clearly exponential and it is out of control. But what slows it down? It's absolutely clear that mask wearing, particularly if everyone wears it, will slow the spread. Physical distancing helps slow the spread. By the way, this is not 6 feet. That is 6 feet. Stay away from large crowds. In New Mexico at the time of this recording, that means gatherings over 5 people. Avoid enclosed spaces for long periods of time. Enclosed spaces where people share air is most likely to have virus particles. Try to limit your time in an enclosed space that shares air with others, ideally less than 15 minutes. Every time you think about leaving the house, ask yourself, do I really need to? Is the trip essential? Use the proper hand washing method, and if you can't wash your hands, use hand sanitizer. One good way to remember this is, anytime you open a door, that's a time when you want to wash your hands. Finally, remember, this is not either or. All of these must be done if you would like to minimize your risk of COVID-19 and keep others safe. It really is up to us. Thanks for listening. Talk to you next time.